Supine Bridge. The supine bridge or hip thrust is an exercise that is performed lying on the back. It can be considered both an anti-flexion exercise, since you are working on lumbar stability and hip extension, and a glute activation exercise. Step 1. Tighten your abdominal and buttock muscles by pushing your low back to the ground. Step 2. Raise your hips to create a straight line from your knees to your shoulders. Then, squeeze your core and pull your belly button back toward your spine. Step 3. Hold for 25 to 30 seconds and lower the hips to return to the initial position. Repeat 8 to 12 times. 3 sets in a row. Once daily. 5 days a week. Supine posterior pelvic tilt. It is a good exercise for strengthening the lower spine and hip muscles. It is also recommended for those diagnosed with hip dysplasia or weakening of hip joints. Step 1. Lie on the floor with bend knees and feet on the floor. In this more or less neutral position, the natural curve of the lumbar spine will elevate the lower back somewhat off the floor. Step 2. Exhale and gently rock your hips toward your head. You will feel your lower back pressing into the floor as you do this. Step 3. Stay here for a few seconds. Then, when you are ready, inhale and return to your initial position. Repeat 6 to 10 times. 3 sets in a row. Once daily. 5 days a week. Supine lower trunk rotation. It is an excellent exercise for mobilizing the lower spine and is good for those prone to low back pain. It also helps to train abs, pelvic and other core muscles. Step 1. Lie straight on your back with knees bent and feet resting on the floor. Step 2. Keep your back flat, slowly rotate your knees down towards the floor until you feel a stretch in your trunk, and hold. Repeat 8 to 12 times. 3 sets in a row. Once daily. 5 days a week. Supine piriformis stretch with foot on ground. It is among the excellent exercise for back pain relief and sciatica pain. Step 1. Lie on your back with both knees bent and feet resting flat on the ground. Step 2. Bring one leg over the opposite, crossing at the knees, and interlace your fingers behind your back thigh. Step 3. Pull the bottom leg in the direction of the shoulder on the same side gently. And hold it here for nearly 20 to 30 seconds. Repeat 6 times for each side. 3 sets in a row. Once daily. 5 days a week. Supine single knee to chest stretch. This is one of the straightforward exercises to stretch your glutes. It also helps with lower back pain and other issues. Step 1. Lie straight on your back. Step 2. Bend one of the legs to ensure that the knee touches your chest. Use both hands to support the motion. Step 3. Hold in a place for 3 to 5 seconds, and repeat with the other leg. Repeat 6 times for each leg. 3 sets in a row. Once daily. 5 days a week. Side plank on elbow. It is an exercise that mainly focuses on oblique abdominal muscles, one of the muscles that does not get much work during abdominal crunches. Step 1. Lie on one of your sides, legs extending and fixed from hip to foot. Now get into the side plank position, ensuring that the elbow is exactly below the shoulder. Make sure that your head is in a straight line with your spine. Your other arm can rest on the body. Step 2. Engage your abdominal muscles, drawing your navel toward your spine. Lift your hips and knees from the mat while exhaling. Your torso is straight in line with no sagging or bending. Now, hold the position. The goal should be to hold for 45 to 60 seconds. Repeat 5 times for each side. 3 sets in a row. Once daily. 5 days a week. Supine double knee to chest. It is an excellent and straightforward exercise for the lower back. It stretches your hips and lower spine and relieves pressure from spinal nerves. Thus, it is good for low back pain or even sciatica. Step 1. Lie straight on the back. Step 2. Bend your knees and tighten your lower abdomen so that your knees touch your chest and you feel a stretch in the lower back. Step 3. Hold in the position with the help of both hands for 5 seconds. Repeat 10 to 12 times. 3 sets in a row. Once daily. 5 days a week. Marching bridge. It stabilizes the lower pelvic and also helps prevent lower back pain. Step 1. Start on your back, feet about 12 inches away from your buttocks, hands by your sides with palms up. Press your heels into the ground and lift your pelvis until your knees, pelvis, and shoulders form a straight line. Step 2. Hold your bridge while you lift your right knee toward your chest until your hip is 90 degrees. Next, return the heel to the floor and lift the left knee. Do not let your pelvis sag or your back overarch when raising and lowering your knees. Repeat 6 times. 2 sets in a row. Once daily. 5 days a week.
Cat-camel to child's pose. It is just another variant of cat-camel exercise, but with one additional pose. Quite like cat-camel, it is for stretching the thoracic and lumbar spine. Step 1. The initial position must be like quadrupeds, by coming on hands and feet and making sure that knees are directly under the hips, while hands under the shoulder. Step 2. Cat. Now sink your back towards the floor, and at the same time lift your head up, thus making a curve in your spine, and taking breathe out at the same time. Step 3. Camel. Now, just make the opposing motion, by arching your back to mimic the camel hump. Step 4. A child's pose is a restful pose in yoga, also called balasana in yoga. It involves bending the knees and doing nothing for a few seconds. Repeat 20 times alternating between cat and camel. 3 sets in a row. Once daily. 5 days a week.
Supine dead bug with leg extension. Unlike other core exercises like sit-ups, dead bugs target deeper core muscles like the transverse abdominis, pelvic floor, and erector spinae muscle group. Dead bug exercises can improve your coordination. Step 1. Lie on a mat with your arms extended straight over your chest to form a perpendicular angle with your torso. Next, bend your hips and knees 90 degrees, raising your feet from the ground. Your torso and thighs should form a right angle, as should your thighs and shins. This is the position to get started. Use your core to maintain contact between your lower back and the floor/mat. Ensure that your spine supports this steady and neutral position throughout the exercise. Step 2. Keep your right arm and left leg exactly where they are, then slowly reach your left arm backward, over your head, and toward the floor as you simultaneously extend your right knee and hip, reaching your right heel toward the floor. Move slowly and steadily, breathing in as you perform the extensions, avoiding any twisting or movement of your hips, and abs stop the movement just before your arm and leg touch the ground. Step 3. Reverse the movement and return your left arm and right leg to their starting positions. Move slowly and steadily, exhaling as you go. Step 4. Perform the same movements to the opposite sides, keeping your left arm and right leg steady as you extend your right arm and left leg. Step 5. Do the same number of repetitions on each side. Then, simply return your feet to the ground and sit up when you complete a full set. Repeat 10 to 12 times. 3 sets in a row. Once daily. 5 days a week.
Curl up with reach. An exercise mainly to strengthen your core. It is perfect for strengthening abdominal muscles. In addition, it stretches the lower back, spine, and hips. Step 1. Lie down on the floor with legs bent and arms resting straight. Step 2. Raise your upper body by contracting abdominal muscles. Only use the abdominal muscles to curl up. Step 3. Carry out one extra motion, as if trying to reach for something with both arms. This will add contraction to abdominal muscles and stretch to the lower back, spine, and hips, thus extending the range of motion. Repeat 20 times. 3 sets in a row. Once daily. 5 days a week.
Oblique bicycle crunch. It is an excellent exercise for the abdomen and deep obliques and part of the core strengthening. Step 1. Lie flat on the floor, your lower back hard pressed to the floor, and your hands behind your head. Step 2. Contract your core muscles, drawing in your abdomen to stabilize your spine. Step 3. With your hands gently holding your head, pull your shoulder blades back and slowly raise your knees to about a 90-degree angle, lifting your feet from the floor. Step 4. Exhale slowly. At first, go through a bicycle pedal motion, bringing one knee up towards your armpit while straightening the other leg, keeping both elevated higher than your hips. Step 5. Rotate your torso so you can touch your elbow to the opposite knee as it comes up. Step 6. Alternate to twist to the other side while drawing that knee towards your armpit and extending the other leg until your elbow touches the alternate knee. Repeat 12 to 20 times. 3 sets in a row. Once daily. 5 days a week.